Hello and welcome to this edition of Insights with Acumen, a series of videos taking a different look at data in the public domain and seeing what we can find. I'm Peter Loader. In this edition, we're going to take a look at how a government department can produce a chart like this, which seems to show positive excess deaths in the second half of 2023, and then shortly afterwards, a chart like this that appears to show negative excess deaths in the second half of 2023. We're going to take a look at the new methodology for calculating excess deaths developed by the Office of National Statistics using the 17 weeks of data that we've now got available since they've been using it. I'm going to provide some insight into recent trends in the number of deaths registered in England and Wales and how the latest numbers compare to those before and during the COVID pandemic. And hopefully, by applying a little acumen, I can explain the flaws in the ONS's previous methods in calculating excess deaths and decide whether or not the new method is any better. Before we get started, a bit of terminology. First of all, the data comes from the ONS website, and I do make an occasional reference to 2011 and 2021 census population data, and I've also made a reference to NHS data on the number of COVID vaccines administered in 2021. That happens to be relevant on a couple of slides. I'm going to refer to three periods in the data set. The baseline covers 10 years worth of registered excess death data up to the end of 2019. So that's from the week ending 8th of January 2010 to week ending 27th of December 2019. The COVID period itself starts from the 28th of December 2019 through to the 31st of December 2021 inclusive. I know the first COVID death wasn't recorded till January, 31st of January 2020. But it helps if we've got 2 years complete data with which to compare other years in the data set. The post-COVID period covers 1st of January 22 until the latest data available at the time I created this presentation, which was 26th of April 24 inclusive. Each week has a week number. Most years will have a 1 to 52 week number. That means we can say, well, how does week 3 of this year compare to week 3 in another year? It also means that in 2024, we've got the first 17 weeks of data, so weeks 1 through to 17. The only exception to our 52 weeks years are 2015 and 2020. It's a fairly well-known convention in analysing this type of data, that occasionally you have 53-week years to cater for the fact that we actually have 52 weeks and 1¼ days on average per annum in a year, adding up to 365. Let's begin by taking a look at reported deaths prior to the pandemic. So this chart takes the number of registered deaths per annum occurring in England and Wales for the period 2010 to 2019 inclusive. We've got year on the horizontal or x-axis as it's known, and numbers of deaths in the year on the vertical or y-axis as it's known. So that we can see that in 2010 we had 493,166 deaths reported. 2011 it was slightly lower at just over 484,000, but then it starts to rise, 496,503, slight dip there. We can see 2015 is a particularly high year, 539,000. Remember, that was one of the 53-week years, but only 7,500 occurred in week 53. I know because I looked at the data. And so even at 531,500, it would still be a significant jump up from previous years. If we look visually, we can see the number of deaths year on year in general is increasing. As we said, there are some exceptions, but there's a technique called linear regression, which seeks to estimate what the amount of that increase is per annum. And if we fit a straight line through the data, then the formula for that line is such that I can tell there are around 5,924 on average extra deaths per annum occurring, which is about a 1.2% year-on-year increase through the data period. That technique is particularly useful, as we shall see, for forecasting what we'd expect future number of deaths to be by extending that line beyond 2019. If we look at how those deaths occur by week of the year, which is what we can see on this chart, we've got along the horizontal axis week number going up to 52 with the odd week 53, and on the vertical axis the average number of deaths reported in that week. So the red line is the average over the 10-year data set. We can see that there's clear seasonality in this data. We get more deaths occurring in the first few weeks of the year, week 2 being the busiest one with around about 13,000 deaths typically, whereas in the summer months that drops to something like around 9,000 deaths on average during those weeks. So there is some seasonality to that. We get a big dip in registered deaths during the Christmas week. That's mainly due to the difficulties in registering a death that occurs during that week, and I guess partly contributes to the higher numbers of deaths reported in the subsequent weeks. What we can also do is overlay on top of that the lines for the individual years. So I've got a colour coding here. The darker the line, the older the data set. So the oldest data set, we can just see that dark blue there. The lighter blue ones are shown here. They're the more recent years. What's interesting here is that in the summer we can see the lines are not very far spread apart, so it's pretty consistent the number of deaths that we get in each week. There is some bias towards the more recent years, the lighter coloured lines being on top, which we'd expect because we know we've got that rising trend in deaths each year. In the winter months, particularly January through to April, the first sort of 16-17 weeks of the year, we can see there's quite a lot more variability. So some years are particularly bad. If we have a bad winter, we get more, I guess, elderly people dying in those weeks of the year. It's starting to become a little bit more variable towards the end of the year here, but worth noting that pretty consistent numbers of deaths in the middle part of the year here, high degrees of variability in the first sort of 17 weeks or so of the year. Some years are particularly bad. 2015 was a really high we saw in the aggregate annual deaths data. We can see that's primarily driven by there being a very high number of deaths in January, February in that year. 2018 had a similarly high January, also had a second peak, I guess that's around March time in 2018. So clearly what happens in those 17 weeks is a key driver of whether a year is a good or a bad year, or perhaps I should say a high or a low year from a deaths reported point of view. Just before we carry on and look at what happened in the pandemic period, key points so far. First of all, that rising trend in the number of registered deaths in the 10 years prior to the COVID pandemic. Secondly, the variability in the number of deaths reported each year, and that variability is primarily driven by what happens in the first 17 weeks of the calendar year, with the summer months being a lot more predictable and consistent. So we're going to start looking soon at the ONS methods for calculating how many excess deaths occurred. Clearly, any method that is used for calculating excess deaths is going to depend on the number of deaths that we expect to occur. Given those findings above, that method should take into account the rising trend, otherwise it's going to underestimate how many deaths were expected in the event. And we should also be wary about drawing any conclusions from just the first 17 weeks of any year, because it's a highly variable period of data in the data, as we've seen. So let's examine now the weekly deaths during the pandemic period and beyond. So the first year of the pandemic period is 2020. What I've done in this chart is to overlay on the previous week by week chart the pattern in 2020 shown with the orange line. So what we can see is that it really started to kick in from around the beginning of April. It starts in week 13, we get a slight upturn, and then it really starts to increase rapidly. So that's week ending 3rd of April is week 14. But by the time we get to around week 25, so mid-June or so, we're pretty much back to normal. It does not look as though there are any excess deaths occurring during the summer period. It starts to then increase again from around week 40 or so. Worth noting that the government introduced the second lockdown in week 45, and I guess if they were following the same data that's shown here, we can perhaps begin to understand that. It's probably worth noting, of course, that no vaccines were available at this time. They didn't start to be deployed until December 2020. And just to include the other bit of data here that I'm going to use when we come to 2021, it's worth bearing in mind that by mid-May, we deployed around 30 million first doses and around 41 million by the end of October 2021. Moving on to 2021, you might recall, if you can think back to those times, that the peak occurred a lot earlier in the year. So we can see it over on the left-hand side here. We'd already seen it starting to rise towards the end of 2020. That continued with again a big surge at the beginning of 2021, which seems to return back to what I would call sort of normal levels of registered deaths by around week 10, i.e. the week ending the 12th of March 2021. What we can then see though is that from around week 27, the orange line seems to come significantly above the other lines, which, if you remember, are all tightly packed around the average. And that carries on for the rest of the year. So no excess deaths occurring in this middle period in 2020, but very much different in 2021, despite the vaccine rollout as detailed on the previous slide. Moving on to what I have termed the post-pandemic period and year one of that, i.e. 2022, what we can see is that the orange line is above the red line in pretty much every week of the year. There's the odd one here and there where it dips down very close to and even slightly below the red line. In the first 17 weeks of the year, it's pretty much what you'd expect an average year to look like. I think it's above the red line, but only just. It's well within the mix compared to other years, and probably is what we'd expect given that rising trend in deaths that we'd seen over the pre-COVID period. I don't think we need to be statisticians, however, to see that what's going on beyond week 17 is significantly higher than what we've ever seen before. That definitely looks to me out of the ordinary. Remember that we observed that the previous years were all very tightly packed around the average during the period from sort of May through to probably around October or so. The second post-pandemic year is 2023. Weekly deaths are again above the average in virtually every week of the year. The profile does look a little bit different to 2022. Though in weeks 1 to 17, they are even higher than the worst year that we'd seen before, i.e. 2018 and 2015. But arguably, I think once we've allowed for the rising trend, just about in line with what would be plausible once we've allowed for that rising trend and population growth that may have contributed to that. For the rest of the year, though, from week 17 onwards, it still looks to me significantly higher than what we'd expect to have seen. You could imagine getting some years where it perhaps some weeks rather where it has occasionally gone to that extent above the average, but it's not happened before. They still look significantly higher than the normality, if you like, of the pre-pandemic years. Moving on to post-pandemic year 3, weekly deaths in 2024 so far. We've only got 17 weeks worth of data, taking us up to the 26th of April. My view is that we're pretty much in the mix here, starting to maybe be a little concerned in the last few weeks that we've got the highest ever number of deaths compared to the pre-pandemic period there. But given the overall variability, I'd say there's nothing out of the ordinary. Certainly nothing to suggest that excess deaths or the number of registered deaths are lower than we would expect, but I don't think we would say they're significantly high either, during that period. So now let's examine what this means for annual deaths versus the expected deaths over the COVID and post-COVID periods. So before we look at the different methods in play, I guess we first ought to define what we mean by excess deaths. They can be calculated by subtracting the number of deaths that we would have expected to occur from the number of deaths that actually occurred. With the resulting number, if it's negative, that means that we've had fewer than expected deaths. If it's a positive number, then it means that we've got more deaths, i.e. we have excess deaths. Clearly, the number of deaths, in this case that have been registered, is a factual piece of information. Therefore, the variance in calculation of excess deaths is dependent on how we calculate the number of expected deaths. And this is where the Office of National Statistics has evolved its methods over time. Prior to the pandemic, method 1, it compared the actual deaths in any year with the average number of deaths that had occurred in the previous 5 years. And its published statistics for 2020, the first year of the pandemic, uses this method. In method 2, it adjusted method 1 during 2021 because whilst ordinarily it would have taken then the period 2016 to 2020 inclusive, it thought, hang on, we can't do that because 2020 has already got excess deaths in it from the COVID pandemic. It therefore decided to compare 2021 deaths with the same 5-year period, 2015 to 19 inclusive, that the 2020 deaths were compared to. That seems to make sense. Where things start to go a bit strange is that in 2022, it moved away from using the 2015 to 19 period and decided to use 2016 to 19 and then 2021. So it still excluded 2020, understandable, but we've just seen from the data that in 2021 there are clearly a significant number of excess deaths occurring compared to what we would have expected. So its method for 2022 seems a bit flawed. We'll come on to in a while as to why it's probably done that, but it seems a bit of a strange thing to do to me. Method 4, I think it's fair to say to the layman, is a bit of a mystery. I've got a bit of statistical background and I can sort of understand what they've done. It's tried to apply some statistical techniques that seek to take into account population growth, demographics, so how things like age, gender and region are changing over time, and updated its prediction of expected deaths on this basis. If you're into that sort of thing, take a look on the ONS website, go into the People, Population and Community Health and Social Care section, and you'll see there's an article there explaining the methodology changes. Just a warning, it's got lots of Greek letters in it. The 5th method is my simple method, the one that I applied on slide 5 earlier on the screen, where I just fitted a straight line through the data, and this regression technique tries to minimize the error of that forecast by getting it to closely fit the data, make that fit as close as possible. And what we can then do is once we've got the line through the 10 years data, we can extrapolate that line forward into subsequent years and use that method. I don't think that's a bad method because the reason we've got that rising trend in the data will be due to the changes in things like age, gender and region that have been taking place in that 10-year period. So I sort of question the need to produce a sort of more sophisticated method, and the benefit in my method arguably is that it's quite easy to understand. You can see what I've done, whereas something that's full of Greek letters, that's more difficult to do even for those with a statistical background. So this chart returns us to the annual deaths chart that we saw on slide 5, except that now I've extended the deaths data from 2019 to encompass the pandemic and the post-pandemic period, so an additional 4 years of data. 2020 we saw 614,114 deaths, etc., up to 2023 where we saw 581,000. You can see my dark grey line, which was my linear regression trend line, has been extended for the same period, and the green arrows indicate the difference between what my trend line says should have occurred in terms of numbers of deaths and those that actually occurred, shown by the blue line. And that gives us figures of 67,625 excess deaths in 2020, 33,486 in 2021, etc. So we're still getting deaths, 18,500, 17,000 in 2022 and 2023, more than we would have expected. So 111,000 in total during the pandemic, with 136,000 over the 4 years in total. On this chart, I've now added the red line, which is the ONS methods for predicting deaths. So what did they think the expected deaths should be in each of those years? So method 1 up to 2020, method 2 in 2021, and method 3 in 2022 and 2023. So what we can see is that the green lines have now grown compared to what they were before. So the ONS method is going to predict a higher number of deaths than my method predicted. So you can see the comparable numbers here, 75,000 in the first year of the pandemic compared to my 67,000. That means that in total they're predicting 193,000 deaths over the 4 years, and 129,000 of which, nearly 130,000, occurred during the pandemic period. So the reason those numbers are higher is because of that gap between my trend line and the red line. And there is that gap. So the orange line there is showing by how much the ONS method has overstated, in my view, the amount of excess deaths that have occurred. Why is that? It's because the way in which they're predicting deaths is lagging. It takes an average of the last 5 years. Well, we know that 5, 4, 3, 2 and 1 year ago, we'd expect deaths to have been lower than they are now because of that rising trend. And you can see that historically, the ONS method, all the way back to 2012, has always come up with an expected death figure lower than the actual, whereas my grey trend line, sometimes it's above, sometimes it's below, and in my view, therefore, it's a good way of overcoming that limitation of the ONS method. Of course, we'll never know in reality how many deaths would have occurred in those years had the COVID pandemic not occurred. Now let's take a look at 2024 so far. So remember, we've only got 17 weeks worth of data, and this is the period for which the ONS has changed its method for predicting the number of deaths that should have occurred using its new fancy method that takes into account changes in population, size, age, gender, and region. So what I've done is I've reproduced the charts that we saw before, but now for each of the years, we've got 15 years in total, I've only included weeks 1 to 17 of those years. Colour coding is still the same. So we can see, for example, in reality, in 2024, in the first 17 weeks, we've had 200,182 deaths. However, my forecast, which is the grey line, looks very close to the red line forecast of the ONS, which is 213,817 deaths. Both forecast methods, my simple method and the ONS method, are therefore suggesting that we've had fewer deaths than would have been expected, by the tune of about 13,000 over that period of time. As you may recall, we know that the number of deaths that occur in the first 17 weeks is highly variable, and if you go back to the charts where we looked at it week on week, we could see that it didn't look that different to what we'd have expected to have seen. So we've got to be careful about drawing any firm conclusions from that data. But again, nothing to suggest that we've got more deaths than expected at the moment. So that's all the analysis that I'm planning to show in this presentation. What can we conclude overall from the findings? So it's clear to me from the data that deaths continue to be higher than expected in 2022 and 2023. I don't think we can draw any firm conclusions from 2024 data yet, as the variance in reported deaths in the first 17 weeks of the year is too great. We need to wait to see what happens during the summer and autumn months. Moving on to the methods, then I think it's fair to say that the methods that were in place prior to the pandemic were inadequate, as they overestimated excess deaths during the pandemic period due to the way that those methods were constructed. Method 3 did have the effect of reducing the size of gap between actual and expected deaths, but I don't think it did it on a sound basis. You can't include in your definition of expected deaths a measure that is based upon or includes a period of time where we know that excess deaths were occurring. So I'm not sure why they did that, and perhaps they realised the flaws and needed something fairly quick to address that flaw. I don't think that's a particularly good way of going about it. Method 4 is interesting that it's produced a very similar forecast to my simple trend method. I sort of assume the ONS has got some statisticians who are more suitably qualified than I am, so it actually gives me quite a bit of confidence in my own method. However, I do have a couple of concerns about it. Having applied evidence-based techniques and very successfully as a consultant over the last 20 to 30 years, then one of the things that I always look for is methods that I can explain to people. My acid test is, could I explain it to my mother and would she understand it? I think if you read the methodology document, it's going to be pretty difficult for any layperson to understand what they've done there, so it doesn't really pass that test. More importantly, it says that it factors trends in something they call the age standardized mortality rates. My concern would be, again, a bit like their method 3, is that if they are factoring in to their predictions for 2024 changes in mortality rates that have occurred in 2022 and 2023, then they're baking in to their forecasts the excess deaths that I think it's pretty reasonable to conclude with some degree of certainty have occurred during 2022 and 2023. And therefore, over time, if those excess deaths continue, then actually they won't be reported as excesses because the model will have learned that those are now the norm. The chart I had, or two charts I had right at the beginning, are actually taken from the Office of Health Improvement and Disparities. And I do wonder whether they've had the same challenges and have sought to overcome them in similar ways. Because the ONS, and I'm going to make this a topic for a future presentation, now has a further chart with excess deaths on its own website that gives similar outputs to the second of the OHID charts. So I'm a bit surprised that both organisations are now producing negative excess deaths for the second half of 2023, when this presentation clearly suggests that deaths seem to be running at significantly higher levels than they ever have done during that period. That's going to be subject for a future topic. I can certainly see why the government would want those two organisations to have the same conclusions, but it all seems a little bit strange to me. So finally, a bit of wider context. Does this analysis inform debate on the safety and effectiveness of COVID-19 vaccines? I don't think I'm really qualified to join that debate, but I do have a couple of questions that the analysis does prompt. The first of those is, why, if the vaccines were effective, did excess deaths appear to occur in weeks 27 to 42 of 2021, i.e. after the vaccine rollout, when in 2020, before the vaccine rollout, those same weeks did not show excess deaths once we got through the initial surge? The second one is, if the vaccines are safe, what explanation do we have for the ongoing level of excess deaths in 2022 and 2023. Do I think the new ONS method is part of an organised cover-up of ongoing excess deaths? I have to admit I've changed the wording here. I was going to put probably not, but in the light of seeing that they've refreshed their projections of excess deaths for 2023 retrospectively, I've changed the wording to say one would hope not. But I do think that if the ONS wishes to provide insight from its data, rather than simply collating the data, it needs to up its game. Clearly, methods 1, 2 and 3 were flawed. Methods 1 and 2 we can sort of understand they were legacy methods, but method 3, come on. Method 4, I can see it's a step forward. I just think the ONS needs to be aware of if it is incorporating recent trends in mortality rates for different age groups, and those mortality rates are influenced by excess deaths that are continuing to occur, then after a period of time, the method's no longer going to show those as excess deaths because they'll be baked into the calculation. So that's a bit of a concern and something it needs to think about in the context of how that information and its interpretation is going to be used. So finally, I just wanted to state that I've got no political agenda in producing this analysis. It is genuinely the case that I observed, I think it was towards the end of 2021 or beginning of 2022, that there appeared to be an unprecedented number of medical emergencies occurring at football matches being reported on live television. My observation wasn't informed by any third party. I'm aware that now others have noticed that as well. At the time I hadn't, and I actually, upon noticing it, Googled heart disease and COVID vaccines, and I just found it interesting that the NHS website contained guidance for medical practitioners in relation to occurrences of myocarditis and other health conditions after the application of COVID vaccines to the public. Thank you for watching. Please leave comments, like and subscribe, etc. if you found this video interesting. There will be more. I intend to publish a bit of an update on what's going on with the different versions of excess death calculations that the ONS now seems to be publishing, and I'll also be delving into other topics. I've already done one or two things around some policing areas like Clare's Law and what have you that you can find on my website, which is plinsights.co.uk. It's referenced on the YouTube channel. Thanks for watching. Have a good day.